Achilles tendinopathy or Achilles tendinitis, it's a very common problem among active people, like runners, but also military service members. In this video, I'll discuss what Achilles tendinitis or tendinopathy is and why veterans often have lingering Achilles issues. I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help military veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Achilles tendinopathy, like Achilles tendinitis, it's a painful overuse injury of the Achilles tendon. It's very common among running athletes and jumping athletes, such as members of the military. The term tendinopathy implies degeneration or maybe failed healing due to a constant and continuous overload of the tendon without enough time for that tendon to appropriately recover. When we say tendinitis, we try to really not use that term because tendinitis implies inflammation that may or may not be present within the injured Achilles tendon. Again, it's very much more commonly, it may start out as Achilles tendinitis with some inflammation of that Achilles tendon, but more often what you get is a small area of degradation or degeneration within that tendon. Typically, it's something that occurs over time, not after a specific injury. It's this chronic nagging pain in the back of the heel, just above the heel bone, with running, with jumping, with walking, with the push-off phase of walking. Initially, it's pretty mild, but it can really start to affect you a lot with just daily activities once it gets difficult. Fortunately, at least early on, it doesn't need any kind of surgical treatment. Things like physical therapy and a variety of different modalities can be helpful. If it gets bad enough, injections like platelet-rich plasma or something like that can get it better. Now, the exact cause of the tendinopathy can vary. There's lots of different reasons. In athletes and active individuals, again, it's excessive loading without enough recovery time between training sessions. Where the Achilles tendon inserts, compressive forces on the Achilles tendon and the calcaneus, the heel bone, such as pressure from footwear or from activities that put the ankle in a lot of dorsiflexion, such as uphill running or marching, which obviously would be something that you would see in the military, or some kind of anatomical abnormality, a Haglund's deformity, which is a bump or a large prominence of the Achilles tendon in the back of the heel. Those can contribute to pain as well. Other risk factors for Achilles tendinopathy include decreased strength of the muscles that plantar flex the foot and ankle. It could be deficits in control and the muscular strength of the muscles around the hip. It could be not enough ankle range of motion or the joint below the ankle, what's called the subtalar joint. It could be too much foot pronation. It could be even increased body weight. All of those have been linked to Achilles tendinopathy. If you have ideas for topics for future videos for this channel, whether it's injuries like this, risk factors for injuries, Nexus letters, DBQs, or anything else, leave those in the comments below. Make sure to subscribe to this channel. Click the bell to be notified when I release a new video. If you yourself are interested in a Nexus letter for your injury or condition, click the link in the description below this video and you'll learn more about working with me and working with my team. We do everything we can to make the process simple and quick for you. And I really work hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching this video, and I look forward to working with you more.